And action. Hey everyone, it's DrRic. Katie had a question about eggs. Good, bad, indifferent, white, yellow, egg beaters. If this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I put out new videos. I usually will do a video depending on a question of the day, and you can send me questions. I'm a little backed up, but I had to pick and choose which questions I talk about. But if there's a recurring question over the course of the day, my clinic day, then I'll try to promise a video. I think these things, when I put my ideas online, it might take up to 10 to 20 minutes to express them on a video, one-way talking. But that instead of taking up all of the visit time in the clinic, and really a visit is supposed to be 10 to 15 minutes, and that's it. To break even as far as the small reimbursement by insurance, but I really won't cut my patients short and like to give them more information afterwards. So if you have any questions, put them down below. Otherwise, these are my 2 cents as far as eggs. So it's controversial as far as why we're seeing all these conflicting reports by some of these studies are funded by the egg industry, the beef industry, or the statin industry. And it's important to realize or read through the literature and know how to reference or choose the studies that are acceptable or not. PubMed puts out a lot of great information, and you really have to be published on PubMed, you really have to be putting together a decent amount of data. But you still have to be, as clinicians, we still have to be cautious about who puts the stuff out, who's funding, how the interpretation of the data came about. So the bottom line is we as doctors usually will try to give people healthy suggestions. And a broad statement for most of America is based on what is the biggest killer in America. And the biggest killer in America is still heart disease. And then it's followed by strokes and cancers. And actually, number 5 is being in a hospital or having an iatrogenic cause for death. So just to take it to the number 1 heart disease thing, heart disease in the majority of Americans it happens to is preventable. It's a preventable disease. The problem is it takes 10 to 20 years for it to show its head with regards to the amount of damage you suffered to have a heart attack or to have a near heart attack and require a stent. And it would be nice if we intervened before the 10 to 20 years started. But at that point in time, most people are young, say 20 years of age, and they feel pretty bulletproof. And most of my 20-year-olds that come in to see me are only coming in because they get a discount on their insurance. Wellness exams, I believe, or a spouse is saying, hey, get in to see your doctor because you're snoring too much, or you fart a lot, or you get in to see your doctor. I think women do great with seeing their doctors because they have to have pap smears. Men are terrible. They usually wait till the last minute or till they're not prodded by their spouses or their loved ones. So I think that if you look at the populations, men are usually the ones that have heart attacks. And nowadays, I'd say 50% of the folks that have heart attacks really don't have cholesterol problems, which is why I think Sinatra has a pretty decent point, valid point. However, I can't just go by that, because if I go by that, then the other 50% who do have a heart attack and we didn't watch them and we didn't make suggestions, that's just a shame, because that will, the ripple effect of an adult having a heart attack will affect the whole family, will affect the kids. You might have to go bankrupt. It's disability for a short amount of time. I mean, even if you get a stent, single stent or double stent, and the cardiologists that do stents, I think they're life-altering procedures. They change the course temporarily of massive disease or death. But remember, that's temporarily. Check out my video on cholesterol. I think I mentioned it, or omega-3 oil, I think I mentioned it. But if you don't change any habits, you will eventually get to that point anyway. I think Western medicine, the modern day medicine, is great at procrastinating. If you procrastinate your diseases and your symptoms, we can save you temporarily. But you will your financial lifestyle will be altered from that point on. And if you don't make any changes, your life will be altered soon. So you really have to not just wait for us as standard doctors. Well, I'm not a standard doctor, but you don't just wait for a standard doctor to say, okay, now you're high risk, so please make a change. Try to make a change early. So healthy lifestyle, I always like to post things on Facebook when I exercise. Today I did my max lifts for the last 3 months as far as bench press, squat, military press, just because I was inspired to do so. 1 rep max. And at 56, it's kind of cool that I can still do 1 rep maxes and comparatively more weight than I used to do in my 20s and 30s. So it is kind of cool. I still feel young that way. I will probably pay for it tomorrow. But I followed that with a 75-minute hot yoga class, and that was also near pass out, but I try to push the envelope because I think it keeps me accountable to be in shape. If I'm not in shape, then I will have disease come my way. Just full disclosure, I've had atrial fibrillation, I have fibromyalgia, I have irritable bowel syndrome, and I have a little bit of depression every once in a while. That's part of the fibromyalgia thing. But if I do not watch myself, that means be healthy every week, eat healthy every day, have some form of mindful practice, I will have these things blossom. They should have blossomed. I was about to, that atrial fibrillation, I should have had ablation. I should have, but I didn't. I used alternative medicine to beat it, and I don't have atrial fib anymore. I don't have fibromyalgia anymore. I still have a little irritable bowel syndrome, but I'm working on that. And depression, I think I've controlled it. I will always have these diseases, even if I control everything and stay at a good body mass index, just like my patients. I will always have these diseases, but I hopefully will put them in the closet. Even if you have had a stent, I think you, or bypass for that matter, you will always have that piece of coil, metal in your heart, or the extra vessels in the zipper in your chest. But I think if you crank out a lifestyle change, and the most reproduced evidence of lifestyle change for heart attack, the #1 killer of all Americans, is going to be Ornish's lifestyle change. It doesn't include just eating. There's also a way of life as far as stress reduction, group therapy, exercise, yoga, breath exercise. So it's a lifestyle. It's not just a diet. We as doctors try to focus in on the easiest things that our young people come in with, and it's easy to say, watch your metrics, watch your blood pressure, watch your waistline, watch your heart rate, watch your body mass index. I think those are easy, but I think truthfully some of my colleagues will kind of ignore the BMI and the waistline thing. It's called a waist to hip ratio, because it's just, if you have standard medical training, and I don't, I have more than that, I've invested in that. If you have standard medical training, you're going to be at a loss for what do you do when you make suggestions on you got to lose weight, you got to bring down your BMI, you have to change that hip to waist ratio. What do you do with that? If you don't know anything about exercise, if you don't exercise yourself, if you don't know anything about diets and diet fads or what macronutrients are, how processed food works, you're not going to be able to make the suggestions for those changes until the last minute when there is diabetes, high cholesterol. Because what do we know? With blood pressure, we know bring it down with blood pressure medicine. I know bring it down with healthy lifestyle, breath exercise, stress reduction, proper sleep. Maybe a low sodium diet. DASH diet I think is credible. But if you don't have any of those other things in your toolbox, then the only thing you're going to use for fixing a problem is the single hammer of medicines. I think we have to have other hammers as far as nutrition, stress reduction, mindful practice, exercise, love. So that's why I think integrative medicine is just so powerful. But I digress. The initial question was eggs or no eggs. And I said all that and ranted because if you, again, look at the #1 killer of Americans, it's heart attack, heart disease. If you look at one of the biggest drivers of heart disease, it's plaques. Not all the time, but plaques in at least 50% of the people that have heart attacks, it's associated with plaques. If you have a plaque, that means you have narrowing. Check out my other video on coronary artery disease. You have narrowing of the arteries. You can't have narrowing of your plumbing because you can't choke off the plumbing. If you have narrowing of your plumbing in your house, you can't turn on the faucet for unlimited amount of times because you'll have the sink will overflow. until you use Drano or you decrease the clog and you get water flowing out. Same thing with the heart. It needs oxygen, so it has these pipes, and when you start to choke off the pipes, the muscle doesn't get oxygen. The muscle eventually will decrease its activity. Eventually it will die, and you can't have muscle that dies. You will die, or you'll be significantly disabled. So the idea, again, is if we have plaques that are usually associated with heart attacks, then what are the usual things that cause plaque buildup? Smoking, processed food, imbalanced omega-3 to omega-6 ratios, and cholesterol. So cholesterol is usually going to be associated with the plaque buildup and coronary artery disease. So one of the biggest things I would say that can be reversed will be to lower your daily cholesterol. The American Heart Association and the American Academy of Family Practice suggests you can have a certain amount of cholesterol per day. And I think it's about 300. At least it was 300 a little while ago. I don't know what the newer suggestions are, honestly. I think they're too lenient, honestly. But I think it was 300 about 10 years ago. And it's probably going to be in the range of 200 to 300 now. And I question those numbers. Again, if you have if you have had a heart attack or a bypass or a stent, forget standard. You don't fit under standard. You're damaged already, and the damage you have to reverse. So I had to bring that cholesterol down spectacularly low. And yes, it is aggressive to stop all sources of cholesterol. And what's the highest small package that you can get cholesterol in? Egg. Egg has, I like University of California, San Francisco's listing. I'll see if I can put a link down below, but I like the listing they have of cholesterol in milligram dose per object. They have tofu, they have yogurt, they have milk, a certain amount, and then they have 3.5 ounces of different meats. They have beef ribs, lean, pork chops, beef liver, chicken with skin, chicken liver, shrimp, squid. There's a couple different ones. But yes, per size, which has the highest amount of cholesterol? An egg. And they just measure it as an egg. An egg has, according to UCSF's list, and it's a little bit old, but still, they have about 200. I think it was 212. Let's just take 200. So if you look at other ranges, it'll be about 150 to 200 milligrams of cholesterol per egg. Does anyone ever just eat one egg? No. I did an experiment on myself by having 2 eggs every day, and it's really easy because if I hard boil them, I can just pop it in on my way to work or my way to exercise or after exercise. I just take off the eggshell, I pop it in, I'm done. Easy, right? Easy prep, easy. I'm not a great cook anymore. I probably can get that skill up again. I'm going to have to. But it's easy, and that's what America wants, is easy. So I did that, and I'll show you my numbers. Did that for about 2 months. I saw my cholesterol. I didn't do anything else. I saw my cholesterol jack up by about 20 points the wrong way. Then I stopped it, and I saw my cholesterol drop by about 20 points. And I didn't do anything else different. I'll show you my numbers later. But that UCSF's chart has 212 per 1 egg. And then it has a listing of meats and different things. Like as I mentioned, beef and pork and chicken. And 3.5 ounces is a standard as a measure, although I don't know who eats just 3.5 ounces. One of these things that I used to eat, but I'm putting a hold on my meat intake for the next 3 months and maybe forever. This is like 4.5 ounces. So I don't know how they came up with 3.5 ounces on their measurements, but 3.5 ounces of beef or pork is about the same. It's about 80 milligrams of cholesterol. And that's lean choice beef, and I don't remember which cut of the pork it was. So, and then there's also tuna and salmon and chicken. The livers were spectacularly high. Liver from beef and liver from, I think, chicken was higher than an egg. But excluding that, even if you were to double the meat amounts to 7, let's say 7 ounces for a fish steak or a cut of beef or a pork chop. Let's say 7 ounces. That still gets you, if you have a 7-ounce steak, that's still less milligrams of cholesterol than 1 egg. So, and then you have to take into account, again, does anybody just have 1 egg? And if the suggestion by your doctor or the big groups of doctors is 200 to 300 milligrams of cholesterol per day, and you've had an egg or 2 eggs, you've just gone over your cholesterol suggestions for the day. And that's not to mention what you make on your own as far as cholesterol and what other meat products you'll have later on as far as cholesterol. Trans fats always in there, convert over, high triglycerides convert over. So you have to be careful. And if you have an overabundance and you can't clear this stuff, you're going to be storing it. Where'd you store it? In your liver, and also that's why livers are so high, and also in your blood vessels. So if you have that, I mean, cholesterol is good. You need cholesterol for brain function and fat, but not too much. I mean, that's definitely overdoing it. So the standard American diet is just loaded with excessive amounts of things that hold cholesterol. And the standard American diet does not stress the healthy things that would help lower cholesterol. I really believe that high fiber will, number one, give you satiety. Number two, will act as a magnet to pull excessive amounts of crappy food out in your poop. So there's 2 reasons for high fiber. Even if there's a carb breakdown, then it might be a heavy carb or not, whether you choose your glycemic load, your plate volume, or single macronutrient food products. I still say that the average standard American diet stinks. Those diets that are outside America, I think, are healthy. And I'm suggesting that with the diseases that we might be presented with, as far as new onset heart attack, new stent, even if it's reversed, or bypass and recovery from bypass, you really have no choice. At this point in time, you must reverse that cholesterol quickly, because all those diseases, if they've been fixed temporarily, I shouldn't say all those diseases, let's just say heart narrowing of the arteries, if they've been reversed temporarily, if you make no changes as far as stent, you will need another stent within 6 years, or worse. If you have made no changes as far as bypass, now I don't know, because you can't really stent a bypassed artery, and you're going to be running out of vessels sooner or later, so you got to make some changes. So again, extrapolation is important to figure out, and you have to look at your diet. But if you've had disease, you really have to make some massive changes and stick with them at least for 5 years. And then hopefully you will postpone or reverse your chances for further damage down the line. If you haven't had disease, it's going to be a tough sell for my average 20 to 30-year-olds to say go vegan. But if you're overweight, if your BMI is too high, if your hip-to-waist ratio stinks, if you have high blood pressure and cholesterol issues and diabetes or elevated sugar, pre-diabetes, you got to be thinking about what to do, because something is going to happen. If you make no changes, what typically happens for my 30-year-olds, if you make no changes because I don't feel anything, I don't have any money right now, I got to do this, what's going to happen is in about 6 to 12 months, you'll have another disease pop up, high cholesterol. And in about 6 to 12 more months, you'll have uric acid issues. In about 6 to 12 more months, you'll have high blood pressure. Then in about 6 to about 12 more months, then testosterone will decrease and you'll need an erectile dysfunction pill, which usually gets the attention of most of my guys. Suddenly, if you need an erectile dysfunction pill, suddenly, oh, I must have a medical problem. Versus all the other things, pre-diabetes, big waistline, high BMI, the erectile dysfunction is usually number 1. And then suddenly, when that happens, I think it hits home. But when that happens, I usually will tell my guys, okay, now we really got to make some changes. Because if we don't, then your erectile dysfunction pill won't work anymore. That's what I suggest. And it's true. Because the blood vessels of the penis are one of the smallest blood vessels. They're the first ones affected by narrowing arteries. So if you continue on bad course, even if you get good response from Viagra, Cialis, you are going to have further damage. Kidneys, heart, eyes. So we don't want that. So Katie, you have a good question. So bottom line is, I would not have eggs in your diet. Again, I know it's hard to switch over from standard American or better than standard American diet to vegetarian or vegan. It's a tough sell. But again, the information that Ornish published is outstanding. So I would try to get to that point. If we're going to do it slowly, fine, as long as there's an end point and then the next switch and then the next switch. We have to build to the end point of hopefully a whole food, mostly plant-based diet. But if we're thinking about eggs, no eggs, number one, I wouldn't do egg yolk. Number two, if you're going to do egg white, okay, just do the egg whites from egg. But do your best with separating out the egg yolk from the egg white. Egg yolk is the thing that has the cholesterol. Egg white doesn't have cholesterol. But I'm not sure that we've done any studies on if people can actually separate the two together. Egg beaters are mostly processed egg white, so it doesn't have any cholesterol in it, but I don't know about the processed part, because to get the egg white, to get the egg white to stay in that little carton, you have to put some chemicals into it, so try to get less processed if you can. I don't know what the difference is in price as far as a carton of egg beaters versus actually getting the eggs. And it'd be nice to go organic or free ranged. If you can't, and we're going in stages to get a little bit at a time, that's fine. Go with regular eggs, but again, separate as much as you can out. And if you can avoid beef and pork are about honestly the same amount of cholesterol. You definitely no shrimp, definitely no squid, salmon and tuna. Tuna doesn't have that much cholesterol compared to salmon. Salmon has a little less cholesterol than beef and pork, but then the fish in the ocean, there's an idea about the pollutants in the fish or in the ocean, and mercury and heavy metals and all that other stuff, which before I made my change because of Bob, I used to take a lot of fish oil, sardines, herring, mackerel, salmon, sockeye, but and I still think it's okay. However, I'm doing an experiment on myself, and we'll see what happens. If I can maintain this and come up with some really good dynamics as far as what to do in the kitchen, I'm going to stick with it. And I'm going to push the envelope as far as my exercise. So that's just an experiment I'm doing. As far as my last experiment, we go by randomized controlled trials to make suggestions as doctors to the general population. Everybody in my clinic gets a specific personalized plan. So I always have to kind of pick and choose and see where you are. But this was my self-study. In July of 2017, I got a cholesterol. My cholesterol is 195 and 79. I thought, ooh, that's not good, but I don't know if I was doing healthy stuff at that point in time. I was, I think, mostly pesco vegetarian, mostly. And then I decided to do 2 eggs a day and not vary anything for about 2 months. And between July, hopefully you can see this, between July of 2017 and then my repeat test after 2 eggs every day, my cholesterol shot up. Cholesterol total and then LDL. LDL is usually the big thing that causes or is linked to cholesterol or plaquing from heart attack. Again, this was before 79. This was after 2 eggs every day for about 2 months. And then I decided that when I got that, I was like shocked. Holy crap. My cholesterol shot up and I didn't do anything else different. And I was at levels like my patients. Nothing against my patients. Well, that's what I shoot for my patients, but I was levels at my patients, and I thought I don't want to do that forever. So I went to stop the eggs, and within another 3 months, this is what my cholesterol jumped down to. Total cholesterol of here, and LDL, which is here. So my LDL went back down to 80s, and my total cholesterol 179. And my HDL actually dropped, and that's when I might have been more, that's a limited study. So I gave you my numbers. I might have been more conscious about being healthy from September 2017 till December 2017, because I didn't like that 200. So maybe I varied it a little bit, but the biggest change I did was in July, 2 eggs a day. From September on, no eggs a day. And those are my numbers. So take it for whatever you want, but the eggs for me cause the jack up, and I'm not going to do that anymore. So, and I don't, Katie, I don't do egg whites. I because if I fry in olive oil egg white, to me it doesn't taste that great. I mean, there's something about the taste of egg white and egg yolk. And here's the other thing, which makes it hard to step off the curb and go vegan. When I think about breakfast, I think about what my mom prepared every single day from grade school on till I left for college. Even when I was in college, I still tried to reproduce what my mom prepared for me every day, and it was always spam or sausage, Vienna, scrambled eggs or a sunny side up, and rice. That's what I ate as a staple almost every day. And it just is so cool. I remember I used to mix it all up, and that reminds me of my mom. And there's something that is cool about that. So it's hard for me, it was hard for me to step off of that until I started I started getting older, until I started getting medical diseases. And then I started reversing the medical diseases and researching and learning about nutrition. And now it's a piece of cake. I see the value, I feel the value, and I understand the studies and I interpret the studies. So Katie, if you're gonna try to work your way into it, okay, egg white. Not the egg beaters, they're too processed, egg white. But we have to have a cutoff date for when we just stop. And as I put more of these videos out on vegan eating, hopefully I'll have other substitutes to throw in for a standard American diet. So good question. Other people, please put your comments down below, positive or negative. I'll try to educate myself and my patients on what you might have found. Otherwise, I appreciate you watching till the end and subscribing. Come back and we'll put together more questions for the next clinic.